We start here in Germany, which has hit an unfortunate milestone in the coronavirus pandemic. The country has again recorded more than 22,000 new daily cases, pushing its total beyond the 1 million mark. That's according to figures from the Robert Koch Institute for Disease Control. Germany largely contained the virus's spread during the first wave in the spring, but it's been hit hard by the second wave of infections. AstraZeneca is planning an additional global trial of its COVID-19 vaccine. That after scientists raised doubts about the initial results showing the shot to be 90% effective in a test, where participants, by error, received a half dose followed by a full dose. Experts said that problems with the first trial could hinder AstraZeneca's chances of getting speedy U.S. and EU regulatory approval for its COVID-19 drug. The company says a new trial would focus on evaluating a lower dosage. AstraZeneca is just one company that has published results claiming high efficacy for its vaccine, but none has yet received regulatory approval in the U.S. or the EU. When that happens and vaccines are rolled out, one challenge will be ensuring that they are fairly distributed around the globe.
First, COVID-19 vaccines are on the verge of being authorized. Billions of vaccine doses have already been secured by wealthy countries. This has raised concerns that the jab will arrive much later at lower-income countries. To avoid that, an initiative was founded, COVAX, backed by the WHO. Countries representing 2/3 of the world population have joined. COVAX's goal is to make sure all member states get vaccines, regardless of financial means. But how does it work? On its website, COVAX explains its strategy. Member states pool their efforts and money to support the development of several vaccine candidates. Instead of competing against each other, they then negotiate their pricing together, therefore keeping prices low. Once effective vaccines are available, it says, all participating countries, regardless of income levels, will have equal access to these vaccines. For lower-income countries, it is the only viable way in which their citizens will get access to COVID-19 vaccines. But wealthy countries have other options. States like the UK and countries of the EU have joined the initiative, but they've also made bilateral deals with manufacturers on the side. These bilateral agreements have created an imbalance between the different members, critics say. While poor countries are solely dependent on COVAX, wealthier ones use it as an add-on to its bilateral deals. And there is more. Critics argue that these bilateral deals make it harder for COVAX to do its job, because when a big share of jabs is already promised to individual countries, COVAX can only distribute what is left. For many hotter countries, not all vaccines will be equally suitable, for practical reasons. They are likely to prefer those easier to transport without a difficult cold chain to maintain. And finally, big countries like the US and Russia haven't even joined the initiative. Instead of supporting COVAX, they've only invested in the development of their own vaccines. COVAX, nevertheless, is sticking to its goal. By the end of next year, it wants to have 2 billion doses distributed around the globe.
Joining me now is Elena Books from the German Ethics Council. That's an independent council of experts who advise the German government on questions of ethics, science, and law. Elena, welcome to DW. We just saw in the report that some countries are trying to position themselves to access vaccines first. But shouldn't the most needy countries be the first in line?
Well, there's a real conflict here because countries, of course, have an obligation to look after their own populations. So that's not wrong per se. But at the same time, the pandemic won't be over until all countries can access enough vaccines. We're all in this together. So this is a time to do two things at the same time. Look after your own population, but also help other countries to access enough vaccines for their population. So we'll need to find a balance here.
We're all in this together. Germany is not taking part in the COVAX program. Some might argue that's an example of a rich country exploiting its wealth while others have to wait.
Well, I believe it's very important that Germany does participate in these kinds of initiatives because we do have the means. We're very fortunate. We have one of the first vaccines that actually comes from Germany. But again, we are in the middle of Europe, so we are one of the countries that knows we can't isolate ourselves. We're not an island. And that counts for the entire world. So I really do believe that we need to show some solidarity here.
So break it down for us. What should the priorities be when deciding who should be vaccinated first?
Well, within a country, we, for example, the Council recommended that it should be those with the highest risks, very old people in care homes, for example, those looking after such people because they expose themselves to risks, such as workers in the healthcare system, and then people that have very important functions and roles in society. Internationally, it will depend on how hard a country is affected, but it will also, I'm afraid, depend on some practical aspects because some of these vaccines require some very high-tech distribution and a very developed healthcare system. So we will have to push for vaccines that can be deployed everywhere. And one of the duties of richer countries is to support development of vaccines that can be shipped around the entire world.
What advice specifically are you giving the German government on how to distribute vaccines?
We recommended for national distribution these three groups that I just mentioned. So those with the highest risk first, then those who look after people with the highest risk, healthcare workers, and then people with particularly important functions in society. We did not issue advice on the international allocation, although we did discuss exactly the kinds of questions that we just talked about.
Thank you so much for that perspective. Elena Books, much appreciated.
Thank you.
Well, by the time Christmas arrives, Germany will know more about the impact of a major holiday on controlling the virus, thanks to what is happening now in the United States. Today is Thanksgiving, one of the most important U.S. holidays. The day before Thanksgiving is the most heavily traveled day of the year in America. But this year, public health officials advised people to stay home or risk creating a super spreader event. Well, not everyone heeded that warning. After more than 8 months of social distancing, many are simply eager to see family and friends again. 50 million people are expected to drive or fly by this coming Sunday. 95% of those are expected to travel by car. Only 5% are flying this year. But that is still 2.5 million people. Well, it is a tradition on Thanksgiving to visit the grandparents, but this year, grandmothers, grandfathers, and many elderly will spend the holiday alone. A Washington-based restaurant owner is trying to combat the loneliness by feeding the stomach and the soul.
Thanksgiving celebrations have always been about food. Lots of food.
Traditional cornbread stuffing, sweet potatoes, and then, of course, the turkey. They say people gain 7 pounds over Thanksgiving. This one meal could probably do it.
This year, though, many Americans will eat alone. Corona has turned cooking and eating with others into a danger, especially for the elderly. This is where Mark Bucher and his team stepped in.
We just wanted to make sure that the older population had a Thanksgiving meal, because there's one meal that's really hard to make, if not impossible to make for one person, and that's Thanksgiving. So we can make it for them.
Mark posted his offer of a free meal for people over 70 on social media. He was expecting about 200 people would reply, but 5,000 asked him for dinner.
We found a group of our population that's starving, and they are scared to death to leave their apartments. And as a result, they just don't want a Thanksgiving dinner. They're depending on the Thanksgiving dinner.
So he called on his restaurant staff to get working. The meals are paid by donations. Volunteers are bringing a signal of solidarity as well as dinner.
It's Thanksgiving. Thank you.
I often went to family or to my friend's house for many years. And this year, nowhere. Can't go anywhere.
How do you feel about this?
Pretty sad. It's been, locked in the house for a long time, and you're by yourself, and, it's you and the cat. Just me and the cats. So that's how I'm spending it, except now I'm going to have the meal.
It's very scary when you can't buy food the way you used to buy food. I just peeked in the bag. It looked wonderful. Looked wonderful.
Thank you so much.
A bright moment in hard times and new priorities for a restaurant owner.
This isn't my job. This is my responsibility.
Good news on this Thanksgiving. Well, let's take the story now to Washington, D.C. My colleague, Carolina Chamoy. She is working on this Thanksgiving. Carolina, happy Thanksgiving to you.
Happy Thanksgiving to you, Brent.
We know that fewer people are traveling in America this week, but public health officials say the numbers are still too high. Tell me, you've been out and about. What have you observed?
Well, we know that the CDC, the Centers for Disease Control and Prevention, posted already a long list, and a week ago at least, of update guidelines for safely celebrating Thanksgiving. This includes, of course, wearing a mask, keeping gatherings small and, if possible, outside. And they also say that an older adult or a person with certain medical conditions, that they should completely avoid in-person gatherings with people who do not live in their household. And this makes it, of course, very difficult, Brent, because as you know, Thanksgiving is precisely about family and friends. And this includes, of course, elderly people. So this day feels also a bit sad here in the United States for a lot of families. But the risk is huge. We have to say that the United States has already over 12 million cases to report and more than 260,000 deaths. And this is really worrying.
Yeah, I speak from personal experience. Can't be with my family because of the pandemic this year. What about the nation's airports? Are we seeing a lot of people flying?
Well, the CDC has also recommended against traveling this week and for Thanksgiving especially, but still millions have traveled through the airports in the United States to enjoy this day with their families, students, parents, siblings, or just families who want to gather as they have always been doing. They don't want to change anything in their lives because of COVID-19. And Dr. Anthony Fauci, the country's top infectious disease expert, remember he said that people in airports, that they are going to get the United States into even more trouble than we're in right now already. We went yesterday to Dallas International Airport here in Washington, and we talked to some of the travelers. Let's take a look, Brent.
Travel was great, no problems whatsoever. Everybody that I've seen was, paying attention to the social distancing and everything. Everybody's wearing masks. So there wasn't any problems whatsoever. Travel was actually a whole lot easier than what I thought it was going to be.
Well, as you see, people, some of them feel comfortable. And the thing is, Brent, that traveling seems to be safe, but it's not really. You don't know who you might be infecting. Also, very important to consider the symptoms after COVID-19. What if someone already had this infection? These are also symptoms that have to be taken very seriously. And these are things that a lot of people who we talked to yesterday at the airport are not considering.
Yeah, that's a very good point to make. What about the messages that Americans are hearing? The messages from President Trump and President-elect Biden on this Thanksgiving, they really could hardly be more different, right?
You're completely right, Brent, but this isn't really surprising, is it? I mean, Donald Trump, as we know, has not been taking this pandemic seriously from day number one on. And Joe Biden, he called for solidarity during a speech yesterday. He was making people feel that he knows how difficult it is to keep the distance in a day like today, in a day that is supposed to be full of hacks and gatherings and not really a social distance.
All right, DW's Carolina Chamoy with the latest tonight on this Thanksgiving in Washington, D.C. Carolina, thank you very much. Have a happy and a healthy Thanksgiving.